So we have a very large practice at Mount Sinai. We have, right now we are 8 sleep doctors and 1 PA. And obviously we have a large need for polysomnography, but we have an exponential need and growth for unattended home testing. With the WatchPad allows me to have a system that is validated compared to polysomnography to obtain the index for obstructive sleep apnea therapy, diagnosis and treatment. It is reliable, it is fast, it's easy to use. The technicians, they like it. I get the report very quickly. It allows me to practice in a different model when compared to other systems. What the WatchPad allows me to do is to have a system that is efficient. Not only efficient in the way that you obtain the numbers that allows you to make a diagnosis, is efficient in the way that we created a dynamic and in terms of operational. We stop using equipment to be the center of the universe, and we do point of care, putting the patient in the center of care. For example, we have a once a week Wednesday morning clinic when we reserve space for patients with significant arrhythmias. They come for consultation, I see them, and if I'm allowed, means if I don't need pre-authorization for those cases, we do delivery and instruction of a WatchPad the same day. They go from the faculty practice to the sleep center to interact with the technicians, so they are very well trained and teaching and dispensing WatchPad, and the patient will use a WatchPad that night. Many patients with atrial fibrillation, atrial flutter, they don't have a very significant low ejection fraction. They can have a AFib, but they don't have congestive heart failure, unstable. And if we do not suspect hypoventilation or any significant central apnea or neuromuscular weakness, we provide a WatchPad the same day. They bring the unit the next day. We review the study immediately the next day. And if there is no contraindication for auto CPAP, they get an auto CPAP immediately, and in such a way that in the next few days, when they go for ablation or cardioversion, they have a system in place that they can treat apnea, and we know that that can have an impact on eliminating higher chances of recurrence of their arrhythmia. And so that is working very well. We started with that service about a year. It became very popular for cardiologists because cardiologists, they do not like the waiting, the vacuum, and the inability to send the patient immediately for evaluation, testing, and therapy. And I think as a result of that vacuum, what happens sometimes is they do cardioversion and ablation because they cannot delay the procedure since they have no hope that they can obtain a consultation, diagnosis, and therapy in such a short period of time. If you can do something quick, especially when they have cardiac arrhythmias, it's a plus. So patients, they are very open to the idea to have a sleep study immediately. You grab them in the moment that they are motivated, because if they come to see you, it's the highest moment of motivation. Sometimes if you have to wait too long, the patients, they don't schedule, they postpone, and they disappear. My recommendations to other sleep centers is to have an open mind and the way they do things, that there is not a single answer to all the problems, and you need to have multiple possibilities or opportunities to help different patients. But I think the vast majority of patients, as long as the study is adequate, they like to be tested at home in their home environment. There is always room for polysomnography for more complicated cases, and we do many of them. So you have to be able to separate, balance not only what the patient wants, your capacity, but what are the indications for each case.